Hello, everyone. Welcome to day 2 out of my 90 days challenge of building a solution for Africa. Today, I will show you how I built a free vaccination tracker for children across Africa. My name is Moise Chirusha. So, the urgent challenge that we face is that vaccination tracking is so needed since the data that comes from health across Africa shows that more than a huge number of children, like more than 45% of children in Kenya, miss their vaccination, and that number increases in Angola, and in Congo it shows that that number goes up to 65%. So that is a very huge challenge. And the common barriers which makes that to happen is that many African parents encounter significant obstacle in accessing vaccination tracking. And this includes that they lose sometimes their immunization card during rainy season or in other circumstances. Parent forgets easily their vaccination schedules, or parents really forget when is their next program. And sometimes this is due to internet unreliability in rural areas. So the solution we've made is a free online vaccination tracker. So we can show you how it works. So this is how it is when we get started. So it's simple. First, you have to select the child. So I'm going to put James James as the child. I'm going to choose like James was born today, and I'm going to choose that he's a male. So once we do that, it's going to show that James is 0 week, he's a male, and he hasn't got any vaccination. So we see he has completed vaccination and all the vaccines which are due today. So you can see how it works. So if I add another child, I can add Ruth. So let's say Ruth was born a few months ago in 2025. Let's say Ruth was born in June, on 10th June 2025. And let's say Ruth is a female, a second child. So we see that Ruth is 7 months old. She's a female. She has got no vaccination yet. So she has 14 overdues, and we can see the overdues. So, but let's assume that Ruth got a vaccination, but we didn't put it. So we can mark it as given. We can say the date it was given. We can give the health facility. It can be like Kenyatta Hospital. So I'm recording this video from Nairobi. That's why I can put this data. And then I can put the batch number, but it is optional, and any note, and I can mark it as given. Now I can see that she has completed 1, and the vaccination, she's at 5%. And I can also mark this one also as given. And I can put same hospital, probably different dates. So I can actually change dates that she got the vaccination. I can mark it as given. And as I continue, that will be shown. The same for James. I can say that James got his vaccine today. Which hospital? Kenyatta Hospital. Given. And I can mark if he had any complication. So it shows that only one is due soon, which is the vaccine, which is also at birth. So it is due today. So that is actually the demonstration of how the app works. And we've seen that the key features that it has, it work fully offline. So after the app has loaded for the first time, no need to have internet anymore. You can keep on adding more children. So no installation, no backend, and just one HTML file. So it runs on any device since this data is recorded on the user key. And that is the same dashboard I showed you. So we have used simple technology to create this, just HTML, CSS, and vanilla JS. So this is how our code looks like. So this is our HTML file. So this is where the person has to input the child. We put the child there. And then here we have the statistics. Over there, we put the statistics. And then we put the vaccination schedule. And then we have the model to load that. And on JavaScript, so first of all, we're gonna put the vaccination schedule. So here we have put the vaccination schedule from the Ministry of Health from Kenya, but any country can input their vaccination schedule, and then this data gonna be loaded and it's gonna be accessible through the different platforms. So if you are a developer, you can go through this. I will add the GitHub repository in the link and you can look at it. So thank you so much for joining, and follow us for day 6 out of the 90 days that we have. Thank you.